Hi, it's Japina here, chiming in for lymph flow, answering questions that you have about lymphatic drainage. What is one of the top questions that I get asked every single day? When should I get lymphatic drainage after a surgery? My opinion is you should start getting your pre-op lymphatic drainage 2 weeks prior to surgery. And the minute you know you're going to get surgery, I recommend coming in for a consultation so that I can walk you through how we can customize your experience accordingly to your body and your life. The reason why I recommend a pre-operative session for you is that we're able to do a lot of preliminary treatment, like working on fascial tissue and current lymphatic congestion areas along the hips and the side of the body where generally clients are getting their liposuction done, so that we can start to get that to flow and empty out. So when you do the lipo, when you're doing your procedure, your body essentially is a clean canvas. Post-surgery, you can expect to have swelling pretty much immediately, and that's not a bad thing. That's part of the body that is working on recovering and healing. The body is working really hard to get you back to normal, so don't stress if you start to get swelling, if you feel a little bit of pain. This is all normal. So post-operative, we have 3 phases that we work on over 6 weeks. I recommend getting in within 3 to 5 days of your surgery. First phase is getting you out of that fight flight of being on the surgery table for anywhere from 3 to 6 hours, depending on what you're doing. So we want to help you feel relaxed. We want to help you calm down from your surgery. And then we want to help to start opening the lymph nodes that are inundated with fluid so that they can take up the new fluid and start to drain correctly. Once you have your first drainage, you usually start to immediately have pain relief, because part of the swelling is what causes the pain that's hitting on all of the nerves inside of your body. So that's like the first week, is swelling and pain. Second week, you start to see the swelling and the pain go down. You want to keep monitoring, the drains in your body. Make sure that there's not going to be any infections. The first 2 weeks, if you're going to get an infection, it can happen. Again, this can be a normal part of surgery, so it's no need to stress out. Another good reason why it's good to be seeing your lymphatic drainage therapist right away, because they can, they're not licensed to treat wounds, but they can monitor the wounds and know the signs of infection, like redness and swelling that's not going away. Unusual oozing around the wound, and then we would refer you right back to your plastic surgeon, and they would decide whether they want you to forgo lymphatic drainage right now or continue lymphatic drainage with care. But wounds are something that can happen. They rarely happen, but this is just part of natural process of any kind of surgery that you have. So again, nothing to worry about, and again, something that lymphatic drainage can actually help to move that fluid out of your body so that your body can dump in the right kind of immune response that it needs to heal the wound.